Kwara State, where he graduated in 1987. He had his advanced level certificate at the Kwara State Polytechnic Ilorin in Kwara. He attended the prestigious Ahmadu Bello University, Zaria, Kaduna State, where he bagged his MBBS degree to practice as a medical doctor in 1998. He had his housemanship in the same institution. Thereafter, he was posted to Enugu State for the National Youth Service, that is between year 2001. After the compulsory national service, he secured a job at the Federal Medical Center, FMC, Bida, in Niger State, where he worked between 2001 and 2003. He subsequently had his residency training, specialist training at the Lagos State University Teaching Hospital, Idiaraba, where he qualified as an obstetrician and gynecologist in 2008. He had been with the Lagos State Health Service Commission since 2009, during which he worked at Ajeromi, Ifakojai, Alimosho, and Ikorodu General Hospitals. Allahu Akbar. He presently works at the Etiosa Maternal and Child Care Aja, where he occupies the post of Director, Clinical Services and Training. And he's also the Deputy Medical Director. Dr. Paul is a member of National Electricity Society in NASFAT. He's one of us. He joined NASFAT in 2003 at our Itirei Jesha branch. He served at different executive council as the Health Secretary, Assistant General Secretary, General the Vice Chairman, until he left the position in year 2020. He's happily married to Ajia on Olapo, and the marriage is blessed with children. Brothers and sisters, members that have joined the webinar, it is a pleasure to invite to the microphone so as to discuss with us issues around infertility. Inshallah, our own erudite Dr. Nuruddin Onolapo. Bismillah, Ahlan wa Sahlan. The mic, sir.
Bismillahirrahmanirrahim. Wassalatu wassalam ala nabiyyina Muhammad wa ala alihi washabihi ajma'in. Alhamdulillah rabbil alamin. We give glory to Allah for this opportunity. As a member of IT, I'm proud and privileged to be invited for this webinar. So I want to, as discussed earlier, I'm Dr. Olapo, a gynecologist, obstetrician. I've been practicing for the past 13, 14 years, as was read in my dissertation. So I don't know if I can share, if it's possible for me to share the slide. Can I be made to share the slide?
Yes, of course, you can do, sir.
So let me see, I have a small slide so that people can follow.
You can go ahead, sir.
So I'm trying to do that. So as was just a minute. Trying to select. Just a minute. Okay, so let's just consider. So we'll be discussing issues around infertility. Can this share my slide? If not, I will just continue so I won't waste our time. Now,
This meeting is being recorded.
Somebody, hope you are hearing me. Oh, sorry. So I said I will discuss the topic under the following: epidemiology. We look at the definitions, historical background, definition, types of infertility, requirements for fertility, causes, treatments, prevention. Then we now highlight the issues. By way of epidemiology, I said infertility is a common condition across the world. It affects about 10% of couples all over the world. But in this environment, in Nigeria or in Africa, it can be as high as 30%. They have couples trying to achieve pregnancy. Up to 10% of them can find it difficult to achieve the pregnancy. And it is not only, there's this belief that if there's no pregnancy, it's the problem of the woman. Sometimes the problem is not just restricted to the woman. Some of the problem might be from the man, or sometimes the two of them may have one challenge or the other. While in some cases, after trying to elucidate the cause, you cannot really find anything. So in that case, we have the unknown unknown causes. So about 40% have been ascribed to a male factor, another 40% to female factor, while about 10 to 10% have been ascribed to the fact that you can't really find a particular cause to the infertility. So by way of definition, what do you mean by infertility? Now, infertility simply medically, infertility means inability of a couple to achieve pregnancy after 1 year of regular, unprotected sexual intercourse. We believe that when a couple, they are trying to meet regularly at the right time. If they try for 12 consecutive months and there's no pregnancy, it means there are some form of infertility. Now, it can be primary. Primary means if a woman or a man has not impregnated any woman before, or if a woman has not achieved any form of pregnancy before, so we call that primary infertility. Secondary infertility means, maybe the woman has had miscarriage before, she wants to get pregnant, it's been difficult for her to get pregnant. Or maybe the woman has a child or two, want to have more children, is unable to achieve the pregnancy. That's what we call secondary infertility. Or maybe the man has impregnated somebody who has a child with another woman, so we call that secondary infertility. Sometimes we have what we call voluntary infertility. Voluntary infertility means you have a couple, maybe for any reason, they are married in order to prevent prayer fornication. They know they are dating, they say, okay, I want to marry you. Then you can ask, okay, let's go and pay, do a kidda, let's pay the dowry. So they might, during that period, they might still be in school. Maybe they are not staying together. Or maybe by adventure, they are married. While the man, either for any reason, searching for greener pasture, travel abroad or to another state or another country. During that period, we can't really say it's, we call it voluntary. That is, it's because of that factor, not that they are really trying to achieve pregnancy. So that's what we call voluntary infertility. And that's common in nowadays, because you see, a couple, maybe the man is in UK, the wife is in Nigeria, before the woman joins the man may be coming maybe once in 6 months, once in a year. So that's a form of voluntary infertility. Then sterility. When people say, what do you mean by sterility? Sterility means if a woman or a man cannot achieve or can never achieve pregnancy. That's what we call sterility. And oftentimes, sometimes maybe due to problems that predated the delivery of the man. Maybe a guy was delivered maybe without testes, or maybe there is a major problem. Or if you have a woman that does not have a womb or does not have an ovary, we call that such women, or maybe the woman had operation, maybe she has cancer, they have to remove the ovary where they stored, she has the womb. it means that woman she's sterile, she cannot achieve pregnancy again. Now, so historic background, by way of historic background, we all know from the Holy Quran, Allah did mention in the history that some people have suffered some form of infertility in the past. We remember the history of Anabi Ibrahim alayhi salatu salam, during which he was married for years until he was very old, close to 90 or 100 years. And the wife was in her 90s before she was able to achieve pregnancy. We also remember the story of Anabi Zakaria alayhi salatu salam, who also it took time before the wife was able to achieve pregnancy. We also remember some of the wives of the holy Prophet Muhammad sallallahu alaihi wasallam. Nana Aisha, we all know that yes, Prophet married her at a very young age, but she didn't bear any child for the holy Prophet sallallahu alaihi wasallam. Now, so what are the requirements for fertility? For pregnancy, before pregnancy can be achieved, what does it take? Now, before you can have pregnancy, you must have a mature man and a mature woman. What do you mean by mature man? A mature man is a man that has reached maturity, what we call balaga. That means the man is matured, has developed male sexual organs, and is able to produce. Then, apart from that, what brings about the spermatozoa? There must be reaction control from the brain to the testes. That's the testes. That's where the sperms and spermatozoa are stored. So when they are stored, they have to be released through the lower genital tract, what we call the leg tract, through the penis, into a woman. So when a man can achieve that, we call that man a mature man. And that man that is producing spermatozoa should be able to impregnate the woman. Same is for the woman. The woman is matured if she starts the maturity. What happens during puberty? By the time a woman starts menstruating, which is a mature woman, and she should be able to bear, she should be able to achieve pregnancy, she should be able to bear babies. Now, what brings about that? Now, during menstruation, that's egg production. We have thousands of eggs in the woman, in both sides. We have two ovaries. So the brain, those eggs are stored in the ovary, thousands of them. So on these 1,000 eggs, every month during menses, about 10 of them, about 7 to 10 of them, most of them are dormant, they are asleep. They are asleep. So about 7 to 10 of them, when menses starts, 7 to 10 of them will start maturing, they start developing. So by the mid-cycle, which is about 2 weeks, the egg now matures. When it matures, it matures inside the ovary, it's released into the tube. The tube is where the sperm and the egg meets. So when it's produced, it's released into the fallopian tube. It goes there for about 48 hours. So during that period, if there is a spermatozoa around that time, so it's possible for the egg and the sperm to come together to form the baby. So this cycle, if there's no pregnancy, after 2 weeks, the woman starts menstruating again. So it means that month there's no pregnancy. So that continues every month. So that mature egg is one that can mix with the spermatozoa, what we call the fertilization. So when that takes place, then it means, of course, the woman should be able to achieve pregnancy. Now, so it means we will have ovulated egg, mature egg. Then we will have adequate quantity of spermatozoa in terms of count. Number, you must have minimum of 15 million spermatozoa per mil. Then the sperm must move by about 40%. About 40% of the spermatozoa should move, and about at least 30% of them should be normal. So let me come again. You must have viable adequate spermatozoa, which is spermatozoa of at least 15 million per mil, and the movement should be about 40%. And the normal ones, because we have sperm that are abnormal, those are normal. So normal ones should be about 30%. So when you have a man producing this quantity of spermatozoa released into the woman during ovulation, around ovulation, pregnancy should be achieved. So that's what is needed for a woman to achieve pregnancy. And same is, so when that occurs, after after the fertilization, the egg or the new baby will now move into the womb. It is inside the womb that the baby develops. So these are the minimum requirements for the woman to achieve pregnancy. That's the man must produce adequate spermatozoa. The woman must have mature egg, and the egg to my ovulate, when she ovulates at the right time, when she ovulates, fertilization should take place, and after fertilization, the new baby should move into the womb where it now matures until time for delivery. So, what are the causes of infertility? So, if there's any abnormality along this track, so for example, a baby, a girl, did not mature well. Maturity means during puberty, at about age of 9, between 9 and 12, you see a young girl that's increase in weight, she becomes taller, she develops female sexual characteristics, the breast develops, the axillary hair, the pubic hair, and she start menstruating. So when she starts menstruating, it means she's producing egg, and those eggs should also mature. So it's the mature egg that is now necessary for that one that can mix, that can fertilize the spermatozoa. So after the pregnancy is formed, of course, it's now developed into the womb. So if there's any abnormality along this way, if there's a problem with ovulation, if a woman for any reason is not ovulating well, it may be difficult for her to achieve pregnancy. What is the cause of this ovulation? It might be because of her weight. If the woman is too big, if the weight is too much, maybe a weight of more than 90 kg, or if the weight is too small, less than 50 kilograms, it may affect ovulation. And if there's no ovulation, of course, the ovulated egg is one that fertilizes the spermatozoa. So in that case, it might be difficult for the such woman to achieve pregnancy. Another thing that can prevent ovulation is if the woman is lactating. Some women actually lactate even when they are not breastfeeding. So when there's lactation, it suppresses the process of ovulation. And in that case, if there's no ovulation, definitely there will be no fertilization and no pregnancy. Now, another thing that can affect ovulation is use of drugs. There are some drugs that are used. People that are on diabetic drugs, some of them can affect ovulation. Then some people use psychotropic drugs. Maybe somebody that has mental challenges. There are some drugs when they use some of those drugs, it prevents ovulation from taking place. Some other diseases like thyroid dysfunction, maybe somebody that have goiter, you see that it's swollen neck, or they have either excessive thyroid hormone, or the thyroid hormone is not up to the optimal level. That can also cause an ovulation. That's the woman not ovulating. Or if the person is suffering from cancer, that can also prevent ovulation. Another thing that can prevent ovulation is what we call polycystic ovary syndrome. So women don't menstruate at all because their eggs do not mature. That the cause is not really known. It's common in women that are obese. It's also common in women that have maybe the father or the mother is diabetic, so we can predispose them to having an ovulation. And if there's no ovulation, definitely there's no pregnancy. Then some patients, all these athletes, some of them they do a lot of diet. If the weight is less than the acceptable level, which is less than 50 or more than 90, they are challenging with ovulation. And sometimes when we have tumor factor, maybe for any reason, maybe the woman has had infection in the past, and that's why we advise young ladies when they have discharges or they have abdominal pain, they should seek medical advice. But they might have infection during that period, and in future, the bacteria can damage the tubes. Unfortunately, during that, when it's happening, the one we don't know. It's after 10 years, 20 years that you now probably now need to procreate. That's when you now have challenges. The tube will have been damaged, and that's why we also discourage people that do unsafe abortion. When there is infection during when abortion process is being procured, or the woman has miscarriage, that can also cause tuber damage. Then another thing that can cause because with achieving pregnancy is what we call the uterine factor. So we have problem with the womb, what we call the uterus. There are problems that with the womb that can also lead to a woman finding it difficult to get pregnant. The commonest cause is when the woman after delivery lose so much blood, what we call postpartum hemorrhage. In that case, the inside of the womb, the part of the brain shuts down. In that case, hormone that bring about development of the eggs will be shut down, and the woman may not see her period and she may not ovulate. Another problem is that when the woman procure abortion, done by illegal people, because most people that are trained, like me, I'm not really giving me, I will not do the abortion. So if people that eventually do it are people that are probably not trained to do so. If there's infection, it may affect the womb, and the woman come together, and they prevent the entry of the spermatozoa into the tubes. Another problem that happens to the tube is sometimes, rarely, this is not a common condition, rarely we may have multiple fibroids in the what we call the submucous fibroid, right inside the womb. Only few fibroids are found right inside the womb, what we call submucous fibroids. So in some situations, even when the woman get pregnant, she may have miscarriages. So that's another rare cause of infertility. Then sometimes too, the cervix the cervix may be closed. Usually there will be a pinhole along the cervix. The cervix may be closed. In that case, it may be difficult for the spermatozoa to get into where the eggs are, or the eggs may not even be able to, menstrual may not even be able to find a way out. Sometimes too, for any reason, people that use some herbal concoction or some drugs that they put in their private part, the female genital tract, near the vagina. Some of them are toxic, and they can actually lead to the coming together. In that case, even the woman may not even be able to have sex. The vagina, because the wall of the vagina is very thin, and it can lead to the closure of the vagina. Another thing that can happen is we have congenital abnormality. Some women or some ladies are born with problems right when they were in their mother's womb. So in that case, you said that some women, they don't even have ovary, they don't have womb. So if you don't have that, maybe that woman may not be able to achieve pregnancy. But sometimes too, there is no clear cut between a man and a woman. It seems some ladies, they have testes and they develop normal, they have breasts, they have everything, but they don't have womb. Those are congenital abnormalities. Why some women too, during development, during puberty, the puberty is delayed usually, or it happens too early. So those can also affect chance of the woman getting pregnant. Then for the man, one of the common causes of male infertility is abuse of drugs. People that use like substance abuse, maybe those that use marijuana, excessive drunkard, those that smoke so heavily, that can also affect the process of spermatogenesis. Some men on drugs, some hypertensive drugs can actually affect pregnancy. Some diseases such as diabetes can cause actually weak erection and ditto, making the man difficult to get pregnant. That's why you see some men, they have a wife, you say, okay, she's not pregnant, go and try another one. You see inside when a man married 2, 3 wives, and the 3 of them, no pregnancy. So it means that's the main factor. Then another thing that can happen to the man is that if there's congenital, maybe they have, during childhood, they have infection, they call mons otitis. In Yoruba tribe, they call it gegele. That can, because the virus that causes it moves to the testes and can damage the testicles during that period, during childhood. Another thing is that some people have what we call hernia during childhood, or maybe abnormal location of the testes. Testes sometimes does not descend down into the scrotum. So if it's right inside, but the leaf in the abdomen will affect the development of the spermatozoa, and that will in a way affect the process of sperm development and can lead to infertility. Another thing that can occur is when you have men that long distance drivers, and if they use tight pants, if they are exposed to heat, or where they are working, they are exposed to some chemicals. Those can also can damage the spermatozoa. So those are the causes of infertility. So for the treatment, what usually happens is that when we have a couple, when they present to the hospital, we ask them questions relating to some of these causes I've mentioned earlier. So when did you marry? Where do you stay together or not? How often do you meet? Are you aware of when a woman can get pregnant? And the man too, do you have any erectile problems? So when we ask these questions, we examine them to be sure that the lady is well matured, she has normal adult sexual reproductive organs. Then we do some tests to check to be sure that the woman is ovulating, and the hormone that controls ovulation is normal. Another thing we do is that we do what we call an HSG to check the inside of the womb and the tubes to be sure that it's open, so that spermatozoa are able to get to where the egg is. So after doing that, we also do a scan to be sure that there's no ovarian cysts, no uterine fibroids. Then for the man too, we check the spermatozoa to look at the quantity of the sperm, look at the viability, the motility, the movement of the spermatozoa, and the normal morphology, whether it's normal or not. So behind everything together, we now see if we're able to find a particular cause, then we now treat that particular cause. So we have drugs that can be used to make a woman to ovulate, because one of the common causes of inability of a woman to get pregnant is an ovulation, if there's no egg release. And we also advise on the best time to meet. Usually, a woman can get pregnant during the mid-cycle, because that's when the mature eggs are released, around maybe between the 11th day of the cycle to about the 16th day, around that time. It may not be specific. Some people say, okay, ovulation is 14, or we use half. Half may not be because nature changes. You can't say, okay, 14 days my ovulation day. A woman can actually get pregnant anytime during the cycle, though it's commonest around the peri-ovulatory period. So, of course, those that are on drugs, we advise them accordingly. If there's drugs, they can look for substitutes that will not affect fertility. If drug abuse, of course, we also refer their accordingly to the psychiatrist to make sure that they take care of that. Now, in terms of prevention is the key. Prevention is important because some of the damages happen even when the woman may not even know, when she's not even ready. Maybe she's a young lady, or the boys when maybe about 5, 6 years had moms to educate her. When you see something that is unusual, seek medical advice. If the mom is there, see the hospital so they can treat her accordingly. Then some surgery that can also cause problem. Maybe a man that has appendix that has ruptured, that can also cause problem. We advise that if there's any infection, one is not feeling well, the easiest way is to see the medical practitioner who we advise accordingly. Now, another thing is that when a woman is having discharges, she should make sure she sees a health personnel and should be well treated. Because when it happens, that's one of the commonest causes of tuber problem, tuber blockage. If there's infection, maybe there's vaginal discharge that was not well treated. And the problem is that when the vaginal discharge occurs, it may be when the lady may be in school, she has not even thought of marriage. Now, during that period, it damages the tube, and the effect is shown like 5, 10, 15 years after it has happened. Or people that procure abortion, and that's also not encouraged. So another form of prevention is that when a woman during pregnancy, she started seeing water before labor starts, the best thing is to go to the hospital so that they can check the woman to see whether she's in labor or not. When the water of the baby breaks days before she falls into labor, bacteria can enter into the womb and cause problem in the future for the woman, either during labor or immediately after labor. And those infections can actually damage the tube. And getting pregnant may be difficult. And that's why you see some women, after 1 or 2 children, they find it difficult to get pregnant again. So another thing we also encourage is that, of course, alhamdulillah, God has forbidden fornication or adultery. Sometimes when one fornicates about maybe have 2 or 3 or 4 sexual partners, one can get some diseases from one person and transmit to others. That's also not encouraged. Multiple sexual partner, illegal multiple sexual partner is not encouraged, but that also increases the chances of infection, and infection will not be transmitted to multiple women. So for those on drugs, if there's any untoward reaction, it's better to just see the medical personnel who we advise accordingly. And of course, now we also have Google, or those medical sites. It's not just anything we are not familiar with, we can ask questions. And of course, we also know that we have, in NASFA generally, we have health committee, we do health talk from time to time, one can ask questions, and that will also be addressed. Health education is also important. We're able to tell her when we see something unusual. Most ladies by the age of 10, 11, 12, they should start menstruating. If it's delayed or a woman is not menstruating regularly, the best is to see the medical personnel, because sometimes you have started when the woman starts menstruating. Maybe she's 12 years, she menstruates, the next menstruation will be 2, 3 months after, or she won't menstruate for 6 months before another one. So the best thing is to quickly seek medical advice at that early stage before it gets to a situation where it will be maybe difficult to manage. So basically, these are some of the preventive. Now, the issues that I want us to, summary, issues that I want us to highlight is, one, we should know that, yes, we are not saying that we should not pray when we have challenges with, maybe we have young couple, maybe junior sister or relation or in-laws, and they're finding it difficult to get pregnant within 1 year. It is better they seek medical advice earlier. Most time our people don't come to the hospital early. They will have gone to maybe traditional. I'm not saying that people should not try traditional or should not pray or use herbal medication, but at the same time, you can, as you are doing that, you seek medical advice, because sometimes the problem is just a minor problem. So that's why when you check and it's a minor, something when we don't even need to give them drugs, just advise them, okay, meet at so time, and allow you just put the baraka and you achieve pregnancy. Another thing is, when a woman is getting old, if a woman is about, now that people are career development, procuring master's degree, PhD, so before they get married, maybe late. So if a woman married late, especially at the age of 35, if that woman after marriage didn't get pregnant within 6 months, she must see a doctor. The reason is that fertility reduces with age. The best time a woman should get pregnant is actually from the age of about 20 to 29. That's the best time that fertility is highest. So by the time a woman gets to 35, between 35 and 37, it gradually goes down. And by 40, the chance of fertility is reduced to by almost 75%. So it is also age dependent. Another issue that I want us to highlight is the fact that we should, yes, when we sometimes when people present, they should go and do tests, or maybe they denial, maybe a man and a woman couple go to the hospital. The woman will have done a test, the man will say, I'm normal. Of course, we are not saying you are not normal. It's only by going through all of those investigations, look at the results before you can say, oh, whether you are normal or not. If you are not normal, of course, you won't even be having erection and ejaculation, producing spermatozoa. But it needs to be assessed. So when it's assessed, we can now see where the area is you need to treat, or sometimes we need to have surgery done. So please, males should not deny. When you go to the hospital, most times you see it's only the women. Most times you say, oh, she's not pregnant. It's because it's the problem with the woman. It's actually not about 40% of difficulty achieving pregnancy fertility is because of the man, while another 40% from the woman, and while about 20% from the two of them, or sometimes you cannot even find the cause. So that's very important. Then another issue is that people say, well, I have fibroids, I can't get pregnant. So there's that can make one not to get pregnant. Anybody can get pregnant anytime. And with the technology now, even if you see on women in the 40s, even in the 50s, they are achieving pregnancy by way of technology. There are modifications that can be done to the spermatozoa, to the egg, which will help the couple to achieve pregnancy. So I think those are some of the things I think we should be able to highlight, be able to encourage our friends or couple to seek early medical advice, because most times people come in too late. That's because they've tried traditional, they've tried herbal medication. I'm not saying that herbal medication is not good or we should not pray, but at the same time, let's do the needful. Then why is it that when it's not everything now fails, they now remember to go to the hospital? So we can use the herbal medication we want to use. Of course, be careful, then seek medical advice. That's very important. So in summary, I think I've tried to go through the rudiments of infertility. What is it? Inability for a couple to achieve pregnancy despite regular unprotected intercourse between for a year, and for somebody that's the age of 35 and above, if there's no pregnancy for within 6 months, that person should be able to seek medical advice early. We should medical advice is very important. We need to seek it as soon as possible, because most times the problems are not something so difficult. They are most of them are easy to treat, and with that, inshallah, Allah will see us through, and we pray that we will not be faced with this challenge, because it's associated with so many. In fact, sometimes it can affect the family, it may lead to divorce and so many family disharmony. It has so many social and psychological problems that can follow this infertility. May Allah be with us, and I want to stop here. So we have question or clarification, I should be able to add. Question and answer, I'm true. Assalamu alaikum.
Imam Abdul Ghaffar.
Naam, wa alaikum salam. Warahmatullahi wabarakatuh.
Can I entertain comments or questions? Inshallah.
Naam, we thank our
comments, inshallah.
Yes. We thank our doctor for that. It's an eye opener. A lot of what you just said are things that are known to mostly people in the medical profession, that are not known to most of us, that are we can call ourselves novices as far as the medical field is concerned. So inshallah, let's see if we have questions. I can see some answers. Let me see the questions. Okay, doctor, can you hear very well now? The question is that, can vagina discharge cause infection for the husband? I think that's the only question we have in the Q&A box. But there are some people that are raising their hands.
Okay.
Doctor, can you see the question?
Okay, let me.
I think that's the only one we have there. People that are raising their hands, so please drop their questions in the Q&A box, please. Please drop your questions in the Q&A box, please.
I'm trying to.
Doctor, over to you, doctor.
Now, no, I've not seen the Q and A. The Q and A. Now, for the person that asked for if a, um, if a woman can infect a man if she has vaginal discharge. Now, most of the vaginal discharges cannot be transmitted. So a normal discharge, that's why when a woman has discharge, we are supposed to test it if there is any bacteria. Some of them can actually affect the man, but most of them do not affect the man because as it is, the man releases into the woman. So it's the one that receives. So oftentimes discharge does not affect the man because nothing enters through the urethra. It's the skin that is in contact with the skin of the penis that gets in contact with the vagina. So most of the discharges do not affect the man. So that's my now. Except if that was called vaginal discharge. Now, if we have what we call pelvic infection, it means the discharge has gone up into the tubes. And how can we know? When we ask the woman, oh, when are we having discharge? We examine the woman. If there is pain, we now show maybe she start developing breast and all those things, axillary hair, pubic hair. Now, same is the menopause. The, menopause means cessation of reproductive system, and by the time the period stops completely, that's the completion of the menopause. Now, when about 10 years to that menopause, which can be as early as 40 years, 41 years, 42 years, the quality of the eggs depreciates, it falls. So by the time she's aging 45, 46, most of those the woman will still be menstruating. But most of the time, those eggs cannot, they are old, they won't be able to fertilize the egg. Are we getting it? So I don't want to give a clear cut that a woman 45 can never get pregnant. It is possible for her to get pregnant, but the chances are very slim, except with assisted conception. What do you mean by assisted conception? It is possible to give the woman drugs that can increase the number of eggs because most of the eggs are weak. So if you're able to get some of the eggs out of maybe about 10 eggs, they're able to get maybe 2 or 3 that are still mature, that can still be fertilizable. So when we get that, and we're able to do that with some treatment in the lab, it's possible to. That's why you see some women when they do what they call IVF, 45 years, 47 years, 50, you see that they still achieve pregnancy. While some of them, if the egg is not mature, if it's not fertilizable, means it cannot mix with the sperm. It cannot fertilize with the sperm. Some people, of course, I know Islam has does not favor the another woman to donate for the man and for the woman, and they mix the spermatozoa of another man. When it becomes the baby, they can now transmit to the into the woman. The naturally child of very low, maybe less than 2%. question I can see that can the late marriage by a man could lead to no, that's one thing. A man, if I studies have shown that even when he is over 100, you can see impregnate a woman. So the age of the woman that matters is the egg. Most times the age doesn't affect egg development and egg maturity. Our great grandparents, some of them say have children up to very late in their life. But for the woman, age is key. Age of the woman is very important. Age of the woman is very important. Usually after the age of 40, 42, the chances tend to be very, very slim. The best between the age of 20 and 29, let's assume it's about less than 90%. Then it now gradually reduces. By 35, it's reduced by 50%. So it can be about 50%. So by 37, it may reduce to about less than 10%. So that's what science has taught us. But I know that there's nothing Allah cannot do, but the chances, we talk about probability and the chances are very slim. What can cause reduction in the duration of menstruation? Like someone to 3 days. Now the body of the woman, you can see nature is not static. And that's why you see, even when you look at the time we observe prayers, Salat, Maghrib sometimes you can see, now I think Maghrib is about 6:20 or thereabout. Sometimes it's 6:30, while sometimes it's around 7 o'clock. The body of the woman too go through rhythmic changes, natural changes. So it may change 3 days, later it may change to 4 days. It's still acceptable. A normal menstrual cycle should last between 2 days and 7 days. If a woman menstruates for a day, that is not normal. The woman then you have variation between 2 days and 7 days. So that's what I can say about that. Now, the person now. So what can cause it? Well, sometimes the woman, well, if it's less than, let's say, a day, or psychological factors can also affect reduction in the period cycle. Or maybe depending on that stress is psychologically worried, that can affect the period. It's only, as I've said, when it's less than 1 day, if the woman will for a day or it just stops, that's when it can be a problem. If you menstruate for 2 days, most likely that shouldn't affect fertility. And blockage of the fallopian tube be treated. Now, most times when the tubes are blocked, the first thing that it's difficult to diagnose blocked tube, and that's one of the diagnosis. We have the one to do HSC, put a drug, and the drug they put inside the private part of the woman, and now take X-rays to look at the tracks inside the tube and inside the womb. Now, if the tube is now blocked, honestly, the blocked tube does not have treatment. The only treatment for blocked tube is IVF. And what do you mean by IVF? IVF means they will get through a number of treatments. They will get the sperm of the man, of the husband, harvest the egg of the woman out of her body. There's a way they can treat it in the lab. When it becomes the baby, they will not transfer it into the womb. Just like bypassing the fallopian tube.
Oh, Johnny.
So that's the treatment of fallopian. Sometimes, if it's a minor blockage, sometimes we do what we call flushing of the tube. Oftentimes, the chance of that is just 50-50. So most times, the tubes are blocked. Unfortunately, they are blocked. But the treatment is, if the woman has the money, it's possible to do what we call IVF. The IVF will bypass the fallopian tube. When someone has fibroid and based on the treatment that has been taken, the fibroid gets shrinked, and we told she's good to conceive, but yet to. Now, as I've said during the lecture, fibroid ordinarily does not prevent pregnancy, except if it's submucous. Now, the inside of the womb is like the pear. Just let's imagine it. It's like the pear. Now, the pear, when you cut the pear into two equal halves, you remove the seed and put it back. That's how the womb is. Now, you can see that there is a shiny part in the womb. Is that what separate the womb from the intestine, from the appendix, from other organs? Now, the part that we eat, the fleshy part that we eat, that green part is like the womb. That's where they push the baby during labor. Now, the innermost part, which is the rough part in the pear, in the womb, we call it this endometrium. That's the innermost part of the womb. Now, if there's fibroid around that area, that's the one that may or that can affect pregnancy. So, and it's the one that is problematic. You see the woman bleeding so heavily during menses, or the period may be coming maybe 10 days continuously, 2 weeks continuously. So those are the one now. So, but ironically, another thing is that fibroid usually does not shrink. You can give drugs that can make it shrink temporarily, but when you stop that drug, most times the fibroid will regrow, and that's why the treatment is, except we do surgery for people that have those fibroids, but it's possible to do laparoscopic surgery, minimal access surgery. But oftentimes the fibroid we see in this environment is that they're big ones. So in that case, they have that we do to remove those fibroids, because fibroid is like stone. They are stony. They are like stone. So no drug can actually shrink it, except when you want to shrink it temporarily. Maybe before a woman go for surgery, or maybe the woman is close to menopause. Maybe she's 43 years, 44, 45, and she's having fibroid disturbing her. We can give drugs for the short period, because those drugs it can even make the fibroid to go faster than moving. Of course. Another reason why the woman is not pregnant, not just because of fibroid, only very rare, less than 5% of fibroid cause infertility. So in that case, if it's there, by the time they check everything, the tubes are okay, woman is ovulating, the man's sperm is okay, you cannot operate it and see. And sometimes after that, the woman will now can now conceive. But oftentimes, fibroid in its own does not really cause infertility. Another thing can cause is that maybe the woman is pregnant and can make the pregnancy to miscarry, maybe between the third and the fourth month, especially if the baby implants on the fibroid or around the fibroid. So the next question, my question is, can vaginal thickness lead to infertility? And what can possibly cause the penis not to erect very well and penetrate well? Now, well, I don't think there's anything like that. Now, I know some people have some sexual dysfunctions in which maybe the female the vagina is a bit tight. But usually it's at the beginning. When you have regular coitus, it usually expands. Vagina is something that can expand so much. And that's why you see the head of, imagine the size of the head of the baby being passed through during delivery. So it can stretch so much. So if the person has a tight vagina, what I can just advise is that, one, they should have foreplay, they should romance before having coitus, so that the area. Secondly, if they have regular coitus, regular sex, with that too, it will make it to relax. Now for the penis, weak erection, ranging from stress, if a man is depressed or is diseases like diabetes, that can also make the weak erection. And sometimes too, emotion. So everybody has one form of dysfunction or the other. Maybe the person is broke or is expecting something, they didn't get it in time. All those things, and the brain that through those mechanisms brings about erection and by erection and penetration. So can cause weak erection. Then next question. Sorry, another question. Another question is, what about the relevancy of blood group in selecting a partner in relation to infertility? Blood group does not affect fertility, affect the baby. So, and it's only if a woman is negative, maybe she's racial negative, and the husband is positive. Now, when she now have a baby, the first baby will safe. They can have problems during the pregnancy, because what happens is that if a woman is negative, a negative blood group is less than 15% among the population. So most people are positive. So the man is likely to be positive. So during the first pregnancy, it's possible for the blood of the man or the baby to that of the mother now produce what they call antibodies. So the antibody, when she's now pregnant again, That antibody, if it enters into the baby's blood circulation, it can actually kill the baby or cause jaundice or subsequent pregnancy. In that case, cause problem. But ordinarily, the blood group does not affect fertility. Is there a likely solution for sterility in modern? Of course, there's no what we call. So what we call sterility is if a woman is sterile. Who will like look around, we can give girl. If you like, you can mix it. If maybe they would have moved oh. Hello, sorry, I didn't know. Now I was talking about sterility. If there's no sterility, means maybe the man has no sperm, is expected. There's no sperm. If there's no sperm, of course, unfortunately, it will be difficult for that person to impregnate a woman. Same as the woman. Part of the treatment we do for women that have cancer, some cancer of the ovary, we remove the ovary. That is the end. Except, as I've said, now we have assisted fertility. It's possible for a woman, for us to get the egg of a woman. Let's assume a woman is sterile, either because they remove her womb, maybe during operation, and she wanted to deliver. And they remove the womb. When the womb is removed and she has eggs, it's possible to get her eggs. It's possible to get her eggs and mix it with the husband's sperm. That woman, we have women that what we call surrogate modified sterile. You can see by way of modification, it's still possible for to achieve conception. Now, somebody was asking me, what is a normal menstrual cycle? Has to do with the number of days a woman menstruates and how frequent she menstruates. What do I mean? On the average, most women, the menstrual cycle is about 28 days of the period. Let's assume a woman start her period today. Let's say today is 1st of November, for example, and she another the next period on the 28th of November. It means that cycle length is 27 days. That's from next period. Just like in a year, we're in 2022 now. 2022 is between January 1st and December 31. So same is the menstrual, and a day before the next one. So if you have a woman that see a period on the 1st and see next one on the 27th, it means she has a 26-day cycle. Or we have a woman that see a period on the 1st and see another one on the 20 days. Now, so a normal menstrual cycle is 28 days plus or minus 6. 28 minus 6 is 22. 28 plus 6, 22 days and 34 days. Then 2, that number of days, 3 days, plus or minus. So normal cycle most time is from 3. That's so a normal menstrual duration of menses is between 2 days and 7 days. So medically, when we talk about normal menstrual cycle, is for 2 to 7 days. Is between 22 days and 34 days. Sometimes people say, oh, my period is dark, is slimy. All those do not matter. Affects fertility, doesn't affect, does not have any significance. So it's the number of days, except in some cases when it's too heavy. Maybe woman is seeing blood clots, heavy clots, or she uses pad and the pad does not hold the period. It means that's excessive pattern. You see, maybe a woman oftentimes she first 2 days she changes her pad about 4-5 times, and then the third day or fourth, that for the woman most of the, if, for example, she now uses 3 pad and the pad for that has changed from the normal, so that it means that's an abnormal, and condition like fibroid or some contraceptive drugs. Maybe a woman is on family planning just by medically. And what is cause of ectopic pregnancy? Now, ectopic pregnancy is a pregnancy inside the wrong, any part of the body outside the womb, outside the uterus. Now, as I said, during eggs are stored in the ovaries. Now, when you enter the house, we have the parlor, we have the rooms, and we have the female reproductive system. The vagina is like the passage. You enter the room, then the tube is like going to the rooms, and then the ovary is like maybe the store. Now, this ovary is very, when they develop, they are released into the tubes. So the tube is like, okay, they're in the room that the spermatozoa can get to. And the spermatozoa does not do the tube, pregnancy is not possible. The reproductive system is the tubes, because it's like the room, that's where the sperm and the egg meets, and that's why the baby is formed. About 3 days after, between 3 days, which is like moving from the room into the parlor, as I'm trying to explain. So now, if a pregnancy, for example, the baby stays in the ovary and the baby develops there, that's what we call ectopic. Or maybe instead of the baby that is forming the tube,